Hi, welcome to your supplement on Chapter 15, your Introduction to OB Coding. That's what we'll be taking a look at. Okay, let's quickly look at some definitions. Your antepartum care is occurring before childbirth. It's also referred to as prenatal care, and that can be used interchangeably, and that is also occurring or existing before birth. It's also referred to as the regular health care women receive during pregnancy. Your postpartum care is occurring after delivery. And abortion definition is premature ending of pregnancy. And miscarriage, also used interchangeably with abortion, occurs when a natural cause ends a pregnancy. It can also be called a spontaneous abortion. On prenatal care, it includes the following. It includes your initial prenatal history and physical exam, any other office visits or histories and physicals during the course of the pregnancy. It includes the weight of the mother, the blood pressure, and the fetal heart tones recorded each and every visit, and routine chemical urinalysis. In order to code just prenatal care, for 4 to 6 visits you would use 59425. 7 or more visits would be 59426. If you only had 3 or less, you would use a regular E&M code out of your CPT book. Okay, it normally breaks down to an average of 12 prenatal visits. That would be monthly visits up to 28 weeks gestation, biweekly visits up to 36 weeks, and then weekly visits up until delivery up to 40 to 42 weeks. Any other visits or services within this time frame should be coded separately. Okay, let's take a look at your delivery services. Your delivery services includes admission with your history and physical to the hospital, fetal monitoring, management of uncomplicated labor, your vaginal delivery with or without episiotomy and with or without forceps, or a cesarean delivery, induction of labor, artificial rupture of membranes, and you would reference these CPT codes to look at your codes for your delivery services. Okay, your postpartum care includes office or other outpatient visits, can be following either a vaginal or a cesarean delivery. It's any visits up to and including your 6-week postpartum checkup, and you would reference your CPT code 59430 for your postpartum care. As I just showed you, your OB care can be billed as individual components, but it can also be billed as an entire package. For coding purposes, the following are all considered part of your global OB package: all of your prenatal care, the delivery of the baby, and the postpartum care up to the mom's 6-week checkup. The qualifier for these components are when it all falls under routine care. Learn and identify what falls outside the parameters of routine care. Okay, your global CPT codes for your OB packages. I want you just to notice the differences. Your 59400 says routine OB care including prenatal care, vaginal delivery, and postpartum care. 59510 says exactly the same thing, but it's your routine OB care, including your prenatal care, a cesarean delivery, and your postpartum care. There are also 2 other global CPT code packages. 59610 is your OB care, including your prenatal care, vaginal delivery, and postpartum care, with the emphasis on after a previous cesarean delivery. Now, your after cesarean delivery is a vaginal birth. After cesarean is a VBAC. That's how it's referred to in our world. You also have your 59618, which is the same as 59610, but they have attempted a vaginal delivery and have ended up having to have a cesarean delivery because they could not deliver it vaginally.